Hi everyone, welcome to my channel Elegant Nursing. Today I am going to talk about poliomyelitis vaccine. Poliomyelitis is an infectious disease caused by the poliovirus. It is an enterovirus. Enterovirus means it enters the body through gastrointestinal tract and often moving on to attack the nervous system. The virus enters through the mouth and thereafter multiplies inside the throat and intestines. Once established, poliovirus can enter the bloodstream and invade the central nervous system, spreading along nerve fibers. As it multiplies, the virus destroys motor neurons. Muscle pain, spasms, and fever are associated with the rapid onset of acute flaccid paralysis. Paralysis due to poliomyelitis is almost irreversible. There are three antigenic types. Most cases of paralysis and epidemics are due to type 1. Paralysis due to type 2 is uncommon. Paralysis due to type 3 is less frequent. There are two types of vaccines to protect from those antigenic types. They are OPV, oral polio vaccine, and IPV, injectable polio vaccine, or else inactivated Salk. Oral polio vaccine developed by Dr. Albert Sabin and first used in 1961. This is a live attenuated, which means weakened vaccine. Injectable polio vaccine developed by Dr. Jonas Salk and first used in 1955. It is a killed vaccine. Polio vaccines are administered to infants at the age of 2, 4, and 6 months. Booster doses are administered at the age of 18 months and school entry. Both oral polio vaccine and injectable polio vaccine could be used according to the immunization program of the particular country. Injectable polio vaccine is especially recommended for the patients with congenital or acquired immunodeficiency, those on systemic steroid therapy, and who are on chemotherapy. Oral polio vaccine is administered as 2 drops orally. It's approximately 0.1 ml. Injectable polio vaccine dose for infants and adults is 0.5 ml. When administering oral polio vaccine, you should tilt the child's head back, then squeeze the cheeks gently or pinch the nose to open the mouth. Put 2 drops on the child's tongue. Please repeat the process if the child is spitted out the vaccine. When administering injectable polio vaccine, the child should be held in upright position. Please remember to hold child's arms and legs firmly. Injection should be administered to the anterior lateral thigh in 90 degrees. For adults, it could be administered via intramuscularly or subcutaneously. Both oral polio vaccine and injectable polio vaccine can be administered with other vaccines such as DTP, diphtheria, tetanus and pertussis vaccine, hepatitis B vaccine, with MMR, measles, mumps and rubella vaccine, and Haemophilus B vaccine. Out of these vaccines, injectable polio vaccine should be given via intramuscularly with DTP and hepatitis B vaccine. For polio vaccines, minimum interval of 2 doses is 4 weeks. For oral polio vaccines, it could be stored at -20 Celsius degrees in the freezer compartment of the refrigerator or freezer room for up to 2 years and 208 Celsius degrees in the refrigerator compartment up to 6 months. For injectable polio vaccines, it should be maintained at 2 to 8 Celsius degrees. It should be avoided to freeze these vaccines before it diminishes the potency of injectable polio vaccine. The vaccine should be perfectly clear and colorless. Any vaccine showing particulate matter, turbidity, or change in color should be discarded. Let's have a look on the comparison of oral polio vaccine and injectable polio vaccine. Oral polio vaccine is live attenuated, that means weakened virus uses, and injectable polio vaccine uses killed virus. Oral polio vaccine administered by 2 drops, and injectable polio vaccine it is administered by an injection. Oral polio vaccine very easy to use the medication, and for injectable polio vaccine it should need a professional person. Oral polio vaccine gives the protection for all three antigenic types, as the same injectable polio vaccine also gives the protection for all three antigenic types. And oral polio vaccine provides humoral immunity, mucosal and gut immunity, and it's lifelong. Injectable polio vaccine provides humoral immunity. Oral polio vaccine gives the protection to close contacts who are unvaccinated, and injectable polio vaccine carries no risk of vaccine-associated poliomyelitic paralysis. Oral polio vaccine is inexpensive. Injectable polio vaccine is more expensive than oral polio vaccine. OPV is highly successful in reducing transmission in developing countries as part of eradication strategy, and injectable polio vaccine is highly effective and safe, mostly used commonly in developed countries. It is not administered to persons who have moderate or severe acute illnesses, and should not be given for the patients who have severe allergy to vaccines and the component. Especially you have to remind that oral polio vaccine should not be given to immunodeficient individuals, household contacts of individuals who have immune deficiency diseases, and immune depression due to therapy. Therefore, injectable polio vaccine must be a substitute for oral polio vaccines for above circumstances. Vaccine-associated paralytic poliomyelitis (VAPP). VAPP is increased in persons with immunodeficiency. The risk of VAPP in either recipients or contacts of recipients was very less. In here, local reactions are uncommon, as the same allergic reactions are very rare. Thank you very much for being with Elegant Nursing. Please subscribe the channel if you add something from this video. Thank you once again. Good luck.